Natural disasters are becoming more common and severe because of climate change. Pregnant women and their newborns may be particularly vulnerable to natural disasters for many reasons, including potential disruptions to medical care and food supply, especially in less developed countries. In a peer-reviewed study published in the Journal of Human Resources, researchers Victor Hugo de Oliveira, Inez Lee, and Clement Quintana-Domeque study the impacts of the first hurricane to hit Brazil on births and child health. On the 28th of March 2004, Hurricane Catarina hit southern Brazil with a wind speed of around 160 kilometers per hour. This hurricane was not expected, and its wind speed, economic costs, and infrastructure damages were similar to those of other hurricanes that we've seen in the Americas. In this study, the researchers exploit variation in how close the pregnant mothers were to the hurricane, and variation in the timing of the birth to assess the impact of the hurricane on births and child health. Using administrative data on birth and death outcomes for all babies born in Brazil in the years before, during, and after the hurricane, the researchers found that exposure to the hurricane in the womb significantly worsened the health outcomes of babies born to young mothers, particularly those between 15 and 24 years old. Among this group, birth weight decreased by 82 grams. The probability of being born with a low birth weight also increased by 3.4 percentage points, and the fetal death rate increased by about 1.7%. In contrast, babies born to older mothers between 25 and 49 years old were not affected by exposure to the hurricane. Relative to younger mothers, older mothers are more likely to be married, to have completed high school, and to be participating in the labor force. Given these characteristics of the younger mothers, the researchers believe that the relatively weaker socioeconomic characteristics of younger women may make them more financially vulnerable to these natural disaster shocks, so they might find it more difficult to deal with the stress of the disaster aftermath while pregnant. In summary, this study shows that in utero exposure to natural disasters worsens the health of newborns born to younger mothers, who might have fewer resources to deal with adverse shocks. Unfortunately, because of climate change, the frequency and severity of natural disasters is on the rise. Future work should focus on the socioeconomic and biological mechanisms that mediate the impact of these disasters on certain groups of women. If we can better understand such mechanisms, policymakers will be better equipped to mitigate the harmful effects of these shocks.